Made possible through support from ARC Thrift Stores, Colorado Developmental Disabilities Council, Developmental Pathways, the Limbaugh Law Firm, and the ARC of Aurora. A Think Change training. Hey there, everyone. Thanks again for joining us today for another vodcast Think Change trainings episode, all about finances, assets, and disability, and really what you need to know. Perhaps this is the first time you've tuned in to this series, or maybe you've listened to the whole series and you're wrapping up with us. But today's episode is all about Medicaid buy-in, and I'm so excited that we have a special guest with us today because she really is an expert in this area, and Medicaid buy-in is a really impactful program within our community that more people really need to know about. Before we dive in, just as a gentle reminder, we're not here to give you any medical or legal advice. And if you do need any type of individualized advice, to please consult with your own individual contacts, because this is really meant to provide you with some foundational knowledge to figure out if this is a good fit for you or your loved one, or maybe you're a professional in the field that wants to learn a little bit more about this. So my special guest, I'm so happy she's here with us. If you could do me a favor and tell our viewers and listeners who you are, what you do, and a little bit about yourself.
Sure. My name is Beverly Hersicorn. I'm the Disability and Aged Policy and Program Performance Coordinator, which is a very long way to say that I work on stalled Medicaid applications and broken benefits. I also do policy documentation and implementation. I oversee Medicaid policy for Health First Colorado, Working Adults with Disabilities Buy-In Program, the Children with Disabilities Buy-In Program, Foster Care, Emancipation Medicaid, and former foster care. I work for the Colorado Department of Healthcare Policy and Financing. That's part of the State of Colorado Executive Branch of Government under Governor Polis. We administer Medicaid, which is a joint program funded by both the federal government and the state of Colorado. The authority for Medicaid comes from Title 19 of the Social Security Act. The department that I work for is the single state agency responsible for overseeing publicly funded health insurance plans and programs like Medicaid, the State Child Health Insurance Program, also known as CHIP, the Colorado Indigent Care Program, also known as CICP, the Old Age Pension State Medicaid Program, Home and Community-Based Service Medicaid Waivers, and the Medicare Savings Program.
Holy moly.
It's a lot.
It's a lot. The HCPF in general, that's for short, Healthcare Policy and Financing. I mean, they do so much. And then your super long job title, you also do so much. So it's a very important program all around, as well as the important work that you do within Medicaid buy-in. So before we kind of talk about what Medicaid buy-in is, could you share with us a little bit about really what Medicaid is generally, and like what the financial eligibility is for the program?
Sure.
Yeah.
So Medicaid is health insurance provided by the government, and it began in 1965. It's for eligible low-income adults, children, pregnant women, aged adults, and people with disabilities. It is an entitlement program where states have the option to participate as well as create their Medicaid program to meet the unique needs of each state's citizens. Entitlement programs are rights granted to citizens and certain non-citizens by the federal law, such as Medicaid, Medicare, Social Security, unemployment, and welfare programs. Medicare is considered a safety net when someone cannot afford commercial health insurance. The authority for Medicaid comes from Title 19 of the Social Security Act, as I mentioned earlier, and the federal government, also known as the Centers for Medicare and Medicaid, determines the Medicaid coverage for mandatory required groups. States require Medicaid medical coverage for optional groups like long-term care and what is commonly known as waivered services, such as supported living services and developmental disability services. The state has a contract with the federal government called the state plan that describes eligibility standards, determines type, amount, scope, and duration of medical services, and sets the amount of money that providers are paid, and that are called rates. Examples of state plan services are inpatient, outpatient services, doctor appointments, labs, x-rays, and for children age 20 and under, a program that's specifically called Early Periodic Screening, Diagnosis, and Treatment, also known commonly as EPSDT services. Optional state plan services can include physical therapy, occupational therapy, speech therapy, and vision services, among others. The financial aspect is different depending on the type of service an individual needs. There are requirements to be a Colorado resident, as well as a U.S. citizen or qualified non-citizen. And when we talk about a qualified non-citizen, we're talking about, for example, if an individual has a green card and that allows that person to work. For people with disabilities to qualify for waivers, they must meet the aged or blind or disabled standard of the Social Security Administration. Their income, again depending on the program, must meet certain limits. Some income may not be considered as income. We call that disregards. And some programs will have resource limits, others do not. An example of financial eligibility for waivers would be that a person's income must be less than 3 times the current supplemental security income amount. That income may be a combination of different types of income, like Social Security, also known as SSI, Social Security disability income, also known as SSDI, Social Security survival benefits, child support, trust income, or employment. The individual resource limit is $2,000. We always want people to apply because these calculations can be very complicated, and we may not consider some income. As I mentioned earlier, we have what we call disregards. So I'm going to give you an example of financial eligibility for the state plan, also sometimes known as regular Medicaid. So for children ages 0 to 18 whose household income does not exceed 142% of the federal poverty level, pregnant women whose household income does not exceed 195% of the federal poverty level, parents and caretaker relatives, where the applicant must have a dependent child whose household income does not exceed 68% of the federal poverty level, and adults without dependent children whose household income does not exceed 133% of the federal poverty level. The state plan for Medicaid does not look at resources at all for eligibility. So it really is kind of a complicated
It's very
thing,
complicated.
which is why we always tell people to apply. Do not assume that you won't be eligible for Medicaid.
And I think that's such great advice, because I think it can certainly feel very daunting when you hear all of these different entities that are involved, and then you also hear about, it might feel like you're jumping through a lot of hoops to hopefully get, the help that you need. But I think that is really great. Tips to tell people is that you certainly should still apply if it's something that you feel like you need, because you don't know if maybe it would fall into that disregards area or anything like that, which I don't think a lot of people have really heard of that term before. I think a lot of people, and we've talked about this in some other episodes within this series about the asset limit, but disregards, this is the first time it's come up. So I appreciate you talking about that so that people have kind of a better understanding overall of what Medicaid is.
And there's a whole list of disregards. They're in our rules. I didn't want to overwhelm you with all the different kinds of disregards we have. And it could be that a family is receiving foster care payments. Well, money that's received in a certain way from the federal government or from state governments can be left out of the calculation for eligibility. So there's just a whole slew of them that we would not consider for.
Yeah. So you really don't know unless you try.
You don't know until you try, exactly.
Yeah. And I think what is so great about you kind of giving people a better breakdown of really what Medicaid is, even though it sounds incredibly complicated, now that they have a better understanding of really what it is, and now that viewers and listeners have that information, what is Medicaid buy-in? Because I'm so excited we're talking about this specifically within this episode, because I think it's such an important and truthfully life-changing program that I really don't think enough people know about, and how it can really impact their day-to-day life.
Well, since I mentioned all the different possibilities for people to have very low incomes, I want to talk about the opposite. When people have much higher incomes that they feel, oh, there's no way that I would ever be eligible for Medicaid because my income is so high, or I'm working and I'm getting a raise and therefore I might as well not even apply. So let's talk about the Medicaid buy-in.
Yeah.
The buy-in programs allow individuals who qualify to actually buy into what we call Health First Colorado, which is the professional name for Colorado's Medicaid program. If an individual or family has too much income to qualify for Health First Colorado, under the buy-in program, they may qualify, but by paying a monthly premium, like you'd pay for a premium for commercial health insurance. The monthly premium is based on the total monthly earned and unearned income after any income which is not going to be considered, as I mentioned, disregards. And then resources are not considered for either the adult or the children's buy-in programs.
Great. I think that's really good advice too, is that the way that you put it is that you just buy into it just like you would for commercial, health insurance. And I think that's it may feel like kind of an odd concept, right? Like buying into Medicaid, but people often buy into Medicaid because one, it gives them the healthcare coverage that they need, but two, sometimes when you get Medicaid, you can have supplemental programming such as waivers that Beverly had mentioned earlier, which again could be incredibly life-changing if maybe you need some help in your home, whether that's with cooking, cleaning, getting ready for the day. Maybe it's going to something like a day program where you get day habilitation services. So it certainly could be pretty incredible if you had access to something like that. Could you share with them, is Medicaid buy-in for both children and adults?
Yes, it is, but they're very different. And they're different programs because they come from different authorities. There's a buy-in program called the Working Adults with Disabilities buy-in program that has different qualifications, different income levels, and different ranges of income for the monthly premiums than the Children with Disabilities program. We could talk a bit more about that.
Let's do it.
Well, the reason that somebody might join a buy-in program, either for adult or children, is that it would allow individuals and families to earn and have larger amounts of income while being able to access Medicaid's more robust services. Many times you'll see that commercial insurance will limit the amount of therapies you can get, how many times you could go to a particular provider's office. But Medicaid is going to be giving you the services that you might need outside of that, including durable medical equipment or home health care. Medicaid often has more services than a traditional health insurance plan. Individuals and families can keep their traditional health insurance plan and also possibly qualify for Medicaid to pay for those things not traditionally covered in the commercial health insurance plan. Individuals that qualify for the Working Adults with Disabilities program and also need and functionally qualify for waivered services such as brain injury, community mental health services, elderly, blind, and disabled services, spinal cord injury services, supported living services, and as of January 1st, 2023, developmentally disabled services. We're going to have all the adult waivers available to be used with the Working Adults with Disabilities program.
Which is huge.
It is big.
Yeah.
And when somebody qualifies for Working Adults with Disabilities program, they do not also need to meet the financial limits, which are sometimes more restrictive for waivers. So all they have to meet is a financial eligibility for the Working Adults with Disabilities program. And if you're just qualifying for home and community-based waivers, there's going to be a limit of income that is 300% of federal poverty level. And you'll see as I talk more about this that you could have much more income either through your employment or through your Social Security disability insurance that allows you to stay on the Working Adults with Disabilities program. I wanted to mention that before Medicaid buy-in programs, individuals and families often felt they needed to artificially impoverish themselves to get the necessary health services through Medicaid because they were unable to get them otherwise. Colorado wants to give all Coloradans the dignity of being able to accumulate resources and live independently and contribute to society. So it's a very valuable program for Colorado. There are about 35 states nationwide that have some semblance, some type of working adults with disabilities program, and there's about 13 states that have a children with disabilities program.
So great, but still some ways to go, I think, nationwide when it comes to making sure that people have equitable access to really great programs like this, because yeah, like you said, I mean, it could really help someone with all these different home and community-based services waivers. We mentioned HCBS, that's what HCBS stands for. You may have found out while you're tuning into all of these episodes that there's an alphabet soup of acronyms in the disability world. So we will be sure to try to clarify that within our recordings for you. I really appreciate the breakdown. Could you share a little bit about what would someone need to do to maintain Medicaid buy-in so that they could continue to receive that?
So individuals and families need to stay within the income limits and remain as Colorado residents and meet the disability qualifying criteria under the Social Security guidelines. Additionally, for the working adults with disabilities buy-in program, adults must stay employed, but there are no minimum wage amounts or hours that need to be worked. Volunteer work, unfortunately, is not eligible for this program.
Which is unfortunate, but I understand. If someone, as we're kind of wrapping up this conversation, if someone wanted to explore enrolling into Medicaid buy-in, how would they start? I know you mentioned all these super confusing entities early on when we were meeting with each other. Are any of them included? Do they need to go through a bunch of different places? Is it kind of a one-stop shop? Is it easy?
Well, it is easy,
Great.
And there are a lot of places to apply.
Mm-hmm.
But the first thing that people need to remember is they need to fill out a Medicaid application. No matter what program you want to access for Medicaid, the first step is filling out that application. And you must respond to the questions that include the activities of daily living. That would identify someone as having a disability, because we're talking about programs specifically designed for people with disabilities. The Medicaid application is on what we call our PEAK website at colorado.gov / capital P, capital E, capital A, capital K, PEAK. So that's colorado.gov / PEAK. A person can apply in person at their county of residence's local county office of social or human services, or at a local application assistance site. Paper applications are on the department website and can be dropped off at the county of residence office of social or human services or a local application assistance site. The local application assistance sites are special entities that are allowed to complete Medicaid applications for individuals, and I'll let you know how you could find those in a minute. Applications are also taken by phone at 1-800-221-3943, which is our customer contact center. We also use a state relay, which is 711, and the hours for the customer contact center are 8 to 4, Monday through Friday.
So there are many ways, whether that be in person, online, via phone. If you need help accessibility-wise, it sounds like you have certainly many different alternatives, which is great. Early on, when you were kind of talking a little bit about what would someone need to enroll into Medicaid buy-in, you talked a little bit about activities of daily living. Just in case someone isn't sure exactly what that is, would you care to maybe elaborate a little bit on what an ADL is?
Sure. So if you have mobility issues, if you use a wheelchair, if you have bathing issues, you need somebody to help you in and out of a bathtub or a shower. If you have need help managing your medications or your daily schedule or getting to doctor's appointments. All of these combined are activities of daily living that we don't even think about half the time when we're doing them. But if you're struggling or being challenged by that and need some assistance, that might indicate that you could be eligible for one of our waivers, which would, as I mentioned, target brain injury or target just general disability or because you're aged or so forth.
Mm-hmm. I appreciate that breakdown. And I think it's funny because I think you oftentimes, you don't really think about, okay, you wake up, you touch your alarm clock to turn it off, then you get yourself out of bed, then you go into your bathroom and maybe use the restroom, and then you brush your teeth, and then you wash your face. All of those little steps are activities of daily living. So I encourage you to maybe reflect on yourself or maybe a person that maybe you're helping with, if maybe they are needing a little bit more help with ADLs, maybe, looking into this program could potentially be something that they could benefit from if maybe they don't qualify for regular Medicaid because they have too many resources. So,
and activities for daily living for children might be something like your child is older than 5 years old and is still using diapers, is incontinent all the time, or has trouble focusing because that child has autism, or needs assistance, as I mentioned, with mobility issues and so forth. But they would need something extraordinary, some extraordinary assistance that's outside of their regular age milestones.
Yeah, developmental milestones are certainly something that can be a little confusing, especially if maybe you're a first-time parent. I do feel like pediatricians are pretty good about identifying if hopefully your kiddo is reaching developmental milestones. We do have a developmental checklist available through ThinkChange that we'll be sure to actually link in the show notes that you can check out. And you can also see if maybe your kiddo is or is not maybe reaching those developmental milestones, because then we can see if maybe, they need kind of that extraordinary support beyond the age that maybe they would or would not need that help around. So
for the children's waiver, the Children with Disabilities waiver, I do want to mention that the services that are available are simply state plan services, which are the doctor's appointments and the wraparound, any mental health services, the things that you would need to be screened and so forth. We do not at this time have waivers that are available to be used with the Children with Disabilities program, which is different than the adult one.
Yeah.
I just wanted to point that out.
No, that's super helpful. And it can get very confusing because there are an array of different HCBS waivers, home and community-based services waivers here in the state of Colorado for children and for adults. And we do have a list of what those waivers are also available via ThinkChange. So I'll be sure to also link those as well. And you can check out if maybe there's a certain waiver program that maybe would be a better fit for you or your loved one. And we can kind of go from there and see if maybe it's a good fit for you. So those are all the questions that I had planned for you. Do you have any last minute thoughts or anything that you kind of wanted to wrap up this conversation with?
I do.
Yeah,
I just want to let your viewers know that as of July 1st, of this year, 2022, individuals that are 65 or older can also qualify for the Working Adults with Disabilities program. That's brand new and was not available to them before. As a reminder, that in as of January 1st, 2023, with the pending permission of the federal government, we will allow individuals on the Working Adults with Disabilities program to also be able to receive services from the Developmental Disabilities waiver if they qualify and want to work. So that's brand new too, but we have to wait for that permission from our federal government partners. I also wanted to give you the telephone numbers that are good if you have additional follow-up questions. Our customer contact center, otherwise known as customer service, is 1-800-221-3943. If you need specific questions or have specific scenarios or situations that you want to present and talk to somebody about the buy-in programs, either the adult or children's buy-in, we have a targeted group of people that are experts on that, and their telephone number is 1-800-711-6994. I really appreciate the ARC of Aurora asking about Medicaid and the buy-in programs. But I wanted to let you know that these are, even though this may be new to you, we have quite a few people that have been on the programs and are using the services. Right now, we have 13,913 people on the Working Adults with Disabilities program across the state.
That's amazing. I had no idea.
And we have 1,350 children across the state that are in the Children with Disabilities program. I want you to know as well that adults can earn about $10,279 a month and still be on the Working Adults with Disabilities program and have access to Medicaid services. And let's see, for children, a family of four can earn $10,602 a month and have their child, if they functionally qualify for having a disability, be on the Children with Disabilities program. I do have the breakdowns of the premiums, but right now during COVID, we're not charging premiums.
Okay.
So, and we do not know when the end of the public health emergency is yet. So,
yeah,
you could apply. You could apply for the Medicaid, and we'll look at you for all programs. And if you qualify for the Working Adults with Disabilities program or the Children with Disabilities program, at this point, you're not going to be charged a premium.
Interesting.
It's going to be free.
It's going to be free. So it won't be free forever. It doesn't sound like we have any guidance right now as to when that will end. But right now, as of, summer of 2022, that's where we kind of are right now. So we'll be sure to update the website and page of this episode if for some reason something changes. But I also appreciate the breakdown of kind of, how much an individual can make each month as well as a family, because it certainly makes it sound like Medicaid is much more in reach. And I think so often there's kind of this misconception that, like you said earlier, it's almost like you have to make these individual sacrifices to be almost at this poverty level in order to get access to Medicaid. And certainly that is not the case when it comes to your individual resources, monthly income, and then accessing Medicaid buy-in.
Well, let me tell you about the tiers of premiums when they do come back into effect. So for adults, there's basically 5 tiers. So depending on what your income is, a premium could be $0, $25, $90, $130, or $200. And that's just the adults with disability, working adults with disabilities. For children, there are 4 tiers. It would be $0, $70, $90, or $120.
Okay.
So we're trying to keep the cost sharing in sync with what people have available to be able to spend, but health insurance is so important to have these days.
It's so important. So long story short, Cliff Note version is, if you're an adult, your monthly premium could potentially be between $0 to $200, and then as a child, it could be $0 to $120.
Exactly.
Yeah. So that's how much you would pay per month. So when Beverly's talking about a premium, that's kind of what that means, is that would be your monthly payment in order to buy into Medicaid. Yeah. Awesome advice. I appreciate you closing us out. Anything else that you want to add before we say farewell to our viewers?
No, I don't want to get too much in the weeds. There's a lot, but I think those are the highlights.
No, and I think these are great highlights. I mean, I think you really gave people the information that they need in order to figure out if Medicaid buy-in is right for them or their loved one, or maybe you're a professional in the field who works with someone directly or knows of someone who really could benefit from having Medicaid, and they haven't quite explored this really pivotal program that seems to be pretty critical for many people. I mean, thousands of people are using it throughout the state. So that was a fun surprise for me at the end. I appreciate that. Well, everyone, thank you so much for tuning in. We appreciate your valuable time. We hope you enjoyed this multi-part series all about assets, finances, and disability, and really what you need to know. Beverly, thank you so much for your valuable time. And in the meantime, everyone, stay curious. We'll see you again soon with another series, and take care. Bye.
Thank you. Bye.